Welcome to the Academic Symposium of Group Alexander.
Bienvenidos a nuestra presentación del Grupo Alexander.
Hola, mi nombre es Diana Cortés, soy uno de los investigadores, maestro de ceremonia y director de relaciones públicas. Hello, my name is Diana Cortez. I am one of the investigators, masters of ceremonies, and director of public relationships.
Hola, mi nombre es Jennifer Bautista, soy una de las maestras de ceremonias y directora de relaciones públicas. Hello, my name is Jennifer Bautista. I am one for master for ceremony and director of relations publics.
Hola, mi nombre es Rebeca Salim, soy una de los líderes, maestra de ceremonias, diseñadores y escritora. Hello, my name is Rebecca Salim. I'm one of the leaders, master of ceremony, designer, and writer.
Hola, mi nombre es Diana López, yo soy uno de los líderes del grupo. También soy la secretaria y escritora.
Hello, my name is Diana. I am one of the leaders. I am also the secretary as well as one of the writers.
Hola, mi nombre es Enrique Leiva. Soy el diseñador del web y uno de los directores de relaciones públicas. Hello, my name is Enrique Leiva, and I am the web designer and one of the public relationship directors.
Otro miembro del grupo es Enrique Cortés, pero no pudo estar aquí hoy. Él era el fotógrafo y uno de los diseñadores. Another member of our group is Enrique Cortés, but he could not be here today. He was the photographer and one of the designers. Today we will be discussing about the effects of diseases on a child's brain in its earliest stages and environment.
Hoy vamos a discutir sobre los efectos de las enfermedades de los menores a los cerebros subdesarrollados en las primeras etapas y ambiente.
It is very important to be aware of your health, especially as a child when there are so many risk factors that can detrimental effects on life growing up.
Es muy importante estar consciente de su salud, especialmente cuando está joven, porque hay muchos riesgos que pueden causar efectos negativos durante el periodo del crecimiento.
Some of the diseases we came across are alcoholism, Fetal Alcohol Spectrum Disorder, and Tay-Sachs disease.
Una de las enfermedades que encontramos son alcoholismo, síndrome de alcoholismo fetal y enfermedades de Tay-Sachs.
Alcoholism is a chronic disease where the inability to control drinking is due to emotional and physical dependence on alcohol.
El alcoholismo es una enfermedad crónica que no se puede controlar en el consumo debido a la independencia física y emocional del alcohol.
Alcoholism is caused by a number of individuals, family, genetic, and social factors.
El alcoholismo es causado por un número de individuos, familiares, genéticos y factores sociales.
Alcohol affects two crucial parts of the brain which are vulnerable when a teenager is developing. The two parts are the hippocampus and prefrontal lobe.
El alcohol afecta a dos partes fundamentales del cerebro que son vulnerables cuando un adolescente se está desarrollando. Las dos partes son hipocampus y el lóbulo prefrontal.
The hippocampus is responsible for memory and learning. Heavy usage of alcohol is associated with 10% reduction in the size of the hippocampus, and alcohol may be poisonous to the nerve cell of the hippocampus, causing them to be damaged or destroyed, especially during this time of the teen's development.
El hipocampus es responsable de la memoria y el aprendizaje, y el uso intensivo del alcohol se asocia en una reducción del 10% en el tamaño del hipocampus. Y el alcohol puede ser venenoso para las células nerviosas del hipocampus, causando que se dañen o destruyan, especialmente durante este periodo de desarrollo de los adolescentes.
The prefrontal lobe is responsible for planning, judgment, decision-making, impulse control, and language. Adolescents that drink heavily have smaller prefrontal lobes than their peers who don't drink. Excess alcohol use can cause or mask other emotional problems like anxiety or depression.
El lóbulo prefrontal es responsable de planificar el juicio al tomar decisiones, el control de impulsos y el lenguaje. Los adolescentes que toman mucho tienen óvulos prefrontales más pequeños que sus compañeros que no toman alcohol. El consumo excesivo del alcohol puede causar otros problemas emocionales como ansiedad y depresión.
Also related to alcoholism, there are many cases of pregnant mothers drinking alcohol, which can lead to many health effects towards the unborn fetus.
Otra enfermedad que encontramos es el síndrome del alcoholismo fetal. Es un desorden usado para describir las diferentes clases de enfermedades y efectos causados en los nacimientos de los niños en las mujeres que consumen alcohol cuando están embarazadas.
The disease we came across is Fetal Alcohol Spectrum Disorder, which is a disease used to describe the different kinds of disorders and birth defects caused by women consuming alcohol while pregnant.
Durante el embarazo de una mujer, el cerebro del feto puede estar afectado demasiado con el consumo de alcohol.
The brain is developing throughout woman's pregnancy, leaving the baby at high risk of the brain being affected with regular drinking.
Los diagnósticos del feto causado por la madre debido al alcohol es el síndrome del alcoholismo fetal, los efectos conjetivos relacionados con el alcohol y el trastorno neurodesarrollo relacionado con el alcohol.
The diagnosis on a fetus caused by mother drinking alcohol are fetal alcohol syndrome, alcohol-related birth defects, and alcohol-related neurodevelopment disorder.
Debido al alcohol durante el periodo de trimestre del embarazo lo da más riesgo, en el que va a tener el cerebro pequeño. También pueden resultar en discapacidad intelectual.
Drinking alcohol during the first trimester of pregnancy can lead to a higher chance of the baby being born with a smaller brain. It could also lead to intellectual disabilities.
Pudimos encontrar una enfermedad llamada Trax-X en un raro trastorno hereditario por ciertos tipos que consultan en el cerebro y destruyen las células nerviosas del cerebro y médula espinal.
We were also able to find a disease called Tay-Sachs. It is a rare inherited disease in which certain lipids accumulate in the brain and destroy nerve cells in the brain and the spinal cord, causing spasticity and death in childhood.
En nuestro proyecto recibimos una estrella latina para investigar y implorar sobre su trabajo en nuestra investigación.
Tay-Sachs disease is a progressive fatal genetic condition that affects the nerve cells in the brain. People with Tay-Sachs lack a certain protein that causes a fatty substance to build up in the brain known as GM2.
Las personas con Trax-X también carecen de una enzima específica que se llama hemoxamidase, a que es responsable de descomponer una sustancia causada partícula llamada GM2.
Tay-Sachs usually strikes within 3 to 6 months of age, but could also appear until youth, under age of 10, or strike in childhood.
El Trax-X generalmente ataca dentro de los 3 a 6 meses de edad, pero también puede aparecer hasta la juventud, menos de 10 años, o pueden atacar en la edad adulta.
As concluded by the Department of Health and Human Services, 40,000 children born each year, it is estimated, have fetal alcohol syndrome. It may be as many as 80,000, with half going undiagnosed. About 16 people are diagnosed with Tay-Sachs each year in the United States. All these diseases, alcoholism, fetal alcohol spectrum disorder, and Tay-Sachs disease, can be helped when diagnosed and treated. When not given the call for treatment from an early age, severe consequences may come into play. Many pediatricians can help make that call.
Concluido por el Departamento de Salud y Servicios Humanos, 400,000 niños cada año estimado tienen síndrome de alcoholismo fetal, que pueden hacer tanto como 80,000 con medio de diagnóstico. Acerca de 16 personas están diagnosticadas con la enfermedad de Trax-X cada año de los Estados Unidos. Todas las enfermedades del alcoholismo, síndrome del alcoholismo fetal y enfermedades del Trax-X pueden ayudar como diagnóstico y tratar cuando no están tratados de consecuencias graves que pueden pasar. Muchas pediatras que pueden hacer esa llamada.
In our project, we have been assigned a Latino star to investigate and incorporate their work into our research.
En nuestro proyecto recibimos una estrella latina para investigar e implorar su trabajo de nuestra investigación.
Dr. Eileen Alexander is a pediatrician who works in New York University School of Medicine, Department of Pediatrics.
Doctora Eileen Alexander es una pediatra que trabaja en una universidad de New York en la Escuela de Medicina, Departamento de Pediatras.
A pediatric's job is to help with the health and medical care of infants, children, and adolescents from the birth up to the age of 18.
El trabajo de una pediatra es ayudar con la salud y atención médica de bebés, niños y adolescentes del nacimiento hasta la edad de 18 años.
Dr. Eileen Alexander grew up in Miami Beach, Florida, and studied at the University of Michigan. Not only did she pursue a career at one school, for medical school she studied at the State University of New New York downstate. She had received certifications and lecture such as American Board of Pediatric, IA State Medical License, NE State Medical License, and NY State Medical License.
La doctora Elia Alexander creció en Miami Beach, Florida, y estudió en la Universidad de Michigan. No solo siguió una carrera con una escuela, sino que estudió en la Universidad Estatal de New York, en los estados de New York. Ella ha recibido certificados y licencias tales como Junta Americana de Pediatras y la licencia médica estatal de IA, la licencia médica estatal de INE y la licencia médica estatal de New York.
Dr. Alexander always wanted to be a doctor since she was a little girl. Nobody else in her family was a doctor, and she liked the idea of helping others. She had always loved children, so she wanted to become a pediatrician.
La doctora Alexander siempre quiso ser una doctora desde que era una niña pequeña. Nadie en su familia era médico y le gustaba la idea de ayudar a las personas. Ella amaba a los niños y siempre quiso convertirse en una pediatra.
I recently spoke to Dr. Eileen Alexander and asked her this question. What do you believe is the best method for a child or teen to maintain a healthy lifestyle? She responded, it starts with the parents. Growing up, kids tend to emulate what they see at home. They see in their household where parents who are hardworking eat right, exercise, and there's not a lot of usage of alcohol and drugs. Also, kids who are interested in sports or extracurricular activities, something that they're passionate about, whether it's the newspaper, soccer, music, drama, or any other events. If they put their minds and effort for that, they have goals. People who have positive attitudes tend to stay away from drugs and alcohol. Open relationships where you feel comfortable talking to your parents, teachers, or your pediatrician. You trust that we have your best interest.
Rebecca recientemente habló con la doctora Elia Alexander y le hizo esta pregunta. ¿Cuál cree que es el mejor método para que un niño adolescente mantenga el estilo de vida saludable? Ella respondió, comienza con los padres. Los niños que crecen tienden a emular lo que ven en una casa. Ven en su hogar a los padres que trabajan duro, comen bien, hacen ejercicios y no consumen mucho alcohol y drogas. También a los niños que se les intensan los deportes y las actividades extracurriculares, algo que les apasiona ya que es el periódico y el fútbol y la música, el teatro y cualquier otro de los eventos. Se pone su mente y el esfuerzo para eso. Tienen objeto. Las personas que tienen actitudes positivas tienen que mantenerse lejos de las drogas y del alcohol. Abran relaciones donde se sientan cómodos hablando con sus padres, maestros y su pediatra. Confiesa que tenemos tu mejor interés.
We would like to give everyone a huge thank you for coming to our academic symposium. We look forward to see you all again on April 19th, where Dr. Eileen Alexander will be presenting.
Me gustaría agradecer enormemente a todos por venir a nuestro simposio académico. Esperamos volver a verlos a todos el 19 de abril, donde presentamos a la doctora Elia Alexander.
Does anyone have any questions for us regarding this project or our theme? So we picked this theme because Dr. Eileen, Mr. Strapville asked how we picked our theme. We picked this theme because we got assigned Dr. Eileen Alexander, who's a pediatrician, and since we're all teenagers, we do tend to like to party and stuff, and we don't realize the consequences and the disease that might affect us when we do these certain things. And so we came up with this theme, and today we present it and give you the types of diseases such as alcoholism, Tay-Sachs, and alcohol spectrum disorder.
Is alcoholism the only addiction that people have? Because there's so many addictions in the entire planet. Anything in this entire planet you can be addicted to, actually.
No, it's not the only addiction. We just picked that because, teens do drink, we tend to party, and so it is an addiction. It is referred as an addiction, as Dr. Eileen Alexander has told me.
Would you rather cope with cigarettes, because that's a more popular choice for teenagers at this age?
I don't believe so. He asked if we would use cigarettes to cope with our...
Why don't you focus on that, because that's a more popular thing for teenagers around this age?
I don't really believe cigarettes, maybe marijuana. I haven't seen, it has been a big deal so far with cigarettes. I think cigarettes are more for adults, and I think teens sort of lean more towards weed.
Primeramente comenzamos a investigar sobre la doctora Iria Alexander, después sacamos sobre qué es un pediatra, cómo trabaja un pediatra y sacamos sobre las enfermedades sobre el alcoholismo y el síndrome de alcoholismo fetal.
So I'll answer that in English. So this project, it was a tackle to do, but at the end, I realized that it was a huge compliment for us because, I do take pride that we did finish this. And I think some of you might do this project next year. Am I right? Am I wrong? Maybe? Okay. So what this project has taught me, how to manage my time and how to work with others. And I think this is really going to affect me in my life because once we get out in the real world, we're going to have a job. And that's where we're going to have to work with others and share ideas and incorporate with others. And I believe this project was, there were times where I sat home and I looked at my laptop at a blank PowerPoint, didn't know where to start, didn't know what to do, really didn't have the time to do it, didn't want to do it. But at the end, I did do it. It was a struggle to work with others, but at the end, it all came together, and I'm really proud that we have came this far and we finished this project. All right, so right now we're gonna have a pop quiz, and whoever gets it will get candy, and we'll come around and we'll pass around the candy. So we're gonna start easy. If you guys were paying attention, you probably will get the answer. So, first question is, what 3 diseases did we talk about in this presentation? ¿Qué son los 3 enfermedades que estaban en nuestra presentación?
Can you state your name and then give the answer, please?
My name is Caesar, and the first.
Speak to the microphone. I'm sorry, because we're being recorded here.
My name is Caesar, and the first answer is alcoholism. That's about it.
Alcoholism, alcoholic spectrum disorder, and Tay-Sachs. And I'm Victoria. So.
Thank you.
Okay, the second question is, can anyone describe alcoholism? So,
En español, por favor.
si alguien puede describir la definición de alcoholism. I saw your hand go up first.
Hi, I am Miranda. Hi, I am Miranda. And alcoholism, from what I heard, is an emotional effect on the brain. The frontal lobe is affected, and also the hippocampus gets smaller. So.
All right, our third question is, what is the hippocampus responsible for? La tercera pregunta es, el hipocampo, ¿qué es responsable para? Does anyone know that? You come up again if you know it.
I'm pretty sure the hippocampus is responsible for memory and direction, like short-term.
Who is our Latina star? So, ¿quién es nuestra estrella latina?
Hi, I'm Millie Solis, and it's Dr. Eileen Alexander.
Another question is, can anyone tell us what the theme of this presentation was? Si pueden decirnos qué es el tema de nuestra presentación.
Hi, my name is Miranda again. And the presentation was supposed to present the effects of alcoholism, fetal alcohol disorder, I'm pretty sure, and then Tay-Sachs disorder, and also to show the effects of the diseases.
All right, this is going to be the last question. It's a freebie, so I'm hoping everyone knows this answer. So what was Dr. Eileen's role in the medical field. So, ¿qué era Dr. Eileen's role? Huh? Oh, ¿cuál era su profesión de Dr. Eileen Alexander? Pediatrician? Yeah.
Damas y caballeros, buenos días. Quiero agradecerles a ustedes por venir esta mañana. Good morning. I want to tell you that I appreciate very much that all of you have attended and paid attention. Gracias a las profesoras Maestro Mijales, a la profesora Restrepo por venir a traer sus estudiantes. Gracias a mis estudiantes de Herencia Latina 3. Thank you for coming, Ms. Maestro Mijales, Ms. Restrepo, and bringing your students. And thank you, my students of Spanish for Spanish Speakers 3. All of you are a great audience. I want to thank also Dr. Rica for coming this morning. I want to thank Mr. John Shepard for allowing us to use his camera recording apparatus. Is that the plural? Pardon my English. But again, you are welcome to come back. Hopefully you will all be here for this Thursday, April 19th. Dr. Eileen Alexander will be here. Espero que todos ustedes estén aquí este jueves, el 19 de abril, que la doctora Eileen Alexander estará aquí. Hablará acerca de la presentación que hicieron Grupo Alexander 2018. This Thursday, April 19th, Dr. Alexander will speak on the topic and theme that Grupo Alexander 2018 have researched. So I want to thank finally the Grupo Alexander 2018. They presented themselves. I want to have a nice round of applause if they could come on up. Again, for my far right, el señor Leiva, Enrique Leiva. You got Diana Cortez, Diana Lopez, la Rebeca Salim, y Jennifer Bautista. Gracias. Good morning, ladies and gentlemen. Buenos días, damas y caballeros. Siga, caballero, siga, siga. Ahí está. Welcome to our academic symposium, directed, produced by, the second part, by Grupo Alexander 2018. I would like to introduce to you Grupo Alexander once again from this past Monday. From my left, your right, far left is Jennifer Bautista, Enrique Cortez. I normally name it Argentina, but Enrique Leiva, Diana Cortez, Rebecca, a co-leader, Rebecca Salim, y Diana Lopez, another co-leader. ¿Son todos? Okay. Grupo Alexander 2018. Thank you for coming, Ms. Livingston. Thank you for coming, Ms. Maestro Mijales. Thank you for coming, Ms. Restrepo. And all of your students, thank you for being here as well.
Welcome back to our academic symposium project, Alexander. Bienvenido a nuestro proyecto simposio, Grupo Alexander. Vamos a presentar hoy Dr. Eileen Alexander en parte de nuestro tema. Dr. Eileen Alexander is going to present today in part of our theme. So welcome to the stage, Dr. Eileen Alexander.
Hi, good morning. Buenos dias. Can everyone hear me? Yeah, okay. Thank you for inviting me here. I'm honored to be here. I'm a pediatrician in the local community, and your leaders here decided that they wanted to discuss the effects of alcohol, mostly on the developing adolescent brain. And in addition, I added a little bit of pediatrics in there, early pediatrics. Bienvenidos, buenos días, me llamo doctora Alexander, soy pediatra en la comunidad. Hoy día vamos a hablar de los efectos del alcohol en el cerebro de un bebé y también en niños mayores entrando a ser adultos. Okay. And if you have any questions during the whole thing, feel free to interrupt, okay? But we'll have time at the end for questioning. Okay. So we're going to discuss, I'm going to do this part in English. We can always switch up to Spanish after, so everyone understands. Sound good? Yeah. Okay. This is the effects of alcohol from fetus to adolescent. So we're going to start with something that is well studied and documented, and that's fetal alcohol spectrum disorder, okay? This encompasses any prenatal exposure, and when I say prenatal, it means the baby inside the womb when the mom is pregnant. When the mom drinks any exposure to alcohol, and this can vary throughout the pregnancy and the amount varies as well, can cause preventable birth defects and developmental disabilities. And it's all the range of effects that occur exposed to alcohol, and they can have lifelong implications. So these all encompass the different disorders. So you have fetal alcohol syndrome, which is probably the one you've heard most about. There's partial fetal alcohol syndrome, alcohol-related neurodevelopmental disorder, neurobehavioral disorder associated with prenatal alcohol exposure, and alcohol-related birth defects. Now, these last two were added recently, and that's because they just, some kids won't have any facial abnormalities or anything that you can see, but later on they could have learning disabilities or, depression or even alcohol abuse problems. And so that's why these last couple are now in there, because it's now been proven that has to do with alcohol when they were in the womb. So these are the different, again, characteristics. I don't expect you to know all of them, but in essence, the fetal alcohol syndrome usually has at least two characteristic facial features, and I'll show you pictures of those. You can also have growth retardation, and then you can have neurologic impairment. So you need all those to be fetal alcohol syndrome. If you have partial fetal alcohol syndrome, you still need the facial characteristics and some neurobehavioral impairment, but you don't have to have documented proof that mom was drinking alcohol when she was pregnant. And these last three, the alcohol-related neurodevelopmental disorders and the related birth defects, you've documented alcohol exposure and then some sort of neurobehavioral impairment, whether it's learning disabilities or behavioral issues. We'll discuss those a little bit later, but that's what that encompasses. Alcohol is a teratogen, meaning that it negatively impacts the development with irreversible central nervous system effects. Neuroimaging studies, meaning CT scans, MRIs, studies of the brain, will show abnormal brain structure and function following exposure to alcohol. You can get reduced brain volume, smaller brains, especially in the frontal lobe, the thalamus, and the cerebellum. And these are the areas of the brain that influence impulse control, they affect memory and judgment and coordination. And I know you guys talked about that a little bit on Monday, right? Yeah. Honestly, having a brother or sister that had fetal alcohol spectrum disorder, kids who live in foster care in an orphanage have been found that they are at risk for this. Kids who are in psychiatric care or child services or even in juvie, and these are risk factors. So clinical features, the facial features that we talked about. It's a short palpebral fissure. I'll show you what those are. A thin vermillion border and a smooth philtrum. So these are three different children or babies who have fetal alcohol syndrome. And so you can see, and I know it's hard to tell, but there, yeah.
You got a green pointer on top of that.
Oh, awesome. Thank you. Okay. So the eyes, they're a little bit smaller than normal. It's hard to tell. Then you see it here in the bridge, that like here, it's a little smoother. Most people will have like a little indentation, but they don't. And the top lip is very thin. And so it's showing in an African American baby, an Asian baby, and a Caucasian baby. This is called a palpebral fissure length, and that's shortened, and it's a smaller, you get like a smaller opening in kids who have fetal alcohol syndrome. And these will show the lips and the philtrum. So these top ones, they'll just show them in different categories. So you see that very thin upper lip, and you see how very smooth this is. There's no indent. So these are kids with fetal alcohol syndrome, whereas this row is normal. You see that little indent and fuller lips, and these are all ranges of normal. And you need to look at it. You can't look at when a kid is smiling, because this is a normal child and it looks funny. But because he's smiling, he looks like he has a thin lip and thin. But if he has a straight face, you can see that normal. Again, clinical features, you also have central nervous system abnormalities and growth retardation. And average kids are actually not diagnosed with fetal alcohol syndrome until they're about 9.5 years old, which is surprising. You would think when they're first born, someone would think, oh, they look a little funny or they have some of these characteristics, but a lot of it isn't really diagnosed until later on when they are having more learning disabilities or, coordination or memory or all of the above. So some of the central nervous system involvement, so it can be structural, where you have a decreased head circumference. When a baby comes into the office, we always measure around their head to make sure the head is growing. And kids with fetal alcohol syndrome always have a reduced head, and it's smaller than 10% of normal. And if the kids are really small, then it would be smaller than 3%. They'll also have abnormal reflexes, poor coordination, they'll fall a lot, they might have confusion between right and left, and some will even have recurrent seizures that aren't caused by anything else. And you can get significant developmental delays, executive functioning, meaning when they have to do hard math or calculations, they'll have problems with that. Social skills, some will just have social anxiety. Some kids will, get in trouble, be sent to detention a lot when they're younger, and then obviously older. Some will have reading issues. And then others will also have like mood or behavioral. They'll throw extra tantrums not usual for behavior, attention deficit, impulse control. All of these can be causes. And again, like we talked about before, the neurobehavioral disorder associated, you have confirmed prenatal alcohol exposure and impaired cognition, which are some of the things that we just talked about. And then the alcohol-related neurodevelopmental disorder is another category. And this can't be diagnosed younger than 3 because you don't know, what the kid's behavior or learning will be like until they're at least starting around 3. And again, you need documentation exposure, and then something like intellectual disability, learning memories, issues with their attention, their mood, their impulse control, things like that. Actually, before I go to the adolescents. And then sometimes you'll also just get a baby who is crying a lot, has poor feeding issues. They're just, the mom will tell you, they're never happy, they're never smiling. I can't get them, to be calm. They're irritable, they're nervous. You get some of those to be like a small factor of that maybe something's going on with the baby. And when they're a little older, like I said, tantrums that are just out of the ordinary, late walkers, they're falling a lot. Things like that. And when they're school age, they're having problems with reading, with math. Some kids, they're not making friends. They get into fights or they're hitting at the younger age and when they're older. And these are some of these neurologic issues that then later on they get diagnosed with fetal alcohol. So now let's go into your age group and your peers. So by the time adolescents become adults, adults I think is 21 considered in this category, more than 80% have used alcohol. And in the United States, because this is the legal drinking age of 21, this is what they're categorizing, 47% by 10th grade and 75% by the time they graduate high school. So that's the majority of students. And that's pretty much, under the drinking age. And among ages 12 to 20, you have 50.9% are binge drinkers. Binge drinking is 3 to 5 or more drinks per occasion. So if you're at a party and you have 3 to 5 or more drinks, you're binge drinking. And that's a huge number. That's a lot more than what we used to say when I first started, like medical school and residency. And 13.7% consider themselves heavy drinkers. So each year, about 5,000 children under the age of 21 die as a result of alcohol. In this 5,000, about 1,900 are due to motor vehicle accidents, whether they're driving drunk, their friend is driving drunk, 1,600 homicides, and 300 suicides. So, and alcohol played a factor in all of these deaths. So risk factors. They are divided into family risk factors, individual, peer, and community. So we'll go through what all those are. Family risk factors. A parent who uses drugs or alcohol, the child is more likely. Intrauterine exposure to drugs or alcohol, so that's fetal alcohol syndrome, which we just talked about. If there's marital conflict between the parents in the house, a disturbed family environment, brothers and sisters who use alcohol or drugs, negative life effects if there's a death in the family or a parent who's ill, something like that. And then poor parenting, which could be anything from someone who's harsh discipline, some who have inadequate discipline, child abuse, rejection. Any of these factors can cause a child to turn to alcohol or drugs. Individual risk factors, difficult temperament, low mood, depression, irritability. So all of these, which is why kids who were exposed to alcohol inside in the womb when they were developing and everything, a lot of the kids will have these kind of temperaments and irritability. So they're already predisposed before they were even born to potential alcohol. Motor, language, or cognitive impairments, early aggressive behavior. Kids who are impulsive, aggressive, withdrawn. Some kids who are just, are isolated. They don't have a lot of friends or family. Sensation seeking, anyone who's anti-behavioral problems. Kids who have attention deficit hyperactivity disorder. Low self-esteem. Poor grades or school failure. So any of these can be risk factors. And then peer risk factors, if your friends are drinking or you're in a group of friends who are drinking and smoking, you're more likely to do so as well. If people who aren't people think alcohol is cool, that's definitely something. Decrease in social support. So if there's not a supportive family or teacher or someone in your life, and especially in switching from elementary to middle school, from middle school to high school, those are big transitions socially for most people, and that could be a stressor that can cause drinking. Attending college, believe it or not, is also a risk factor. Education-wise, it's great, but it's a huge environment where there's a lot of, obviously, drinking and binge drinking. Friends who use drugs or alcohol, and if you're social adversity, meaning you don't have many friends or you're having problems with your friends, things like that. And then community risk factors, laws and norms favorable toward alcohol and drug use, like commercials that drinking beer is cool, or in Europe, obviously the drinking age is 18, it's a lot younger, and now they found that kids are drinking and heavy drinking a lot younger. So the fact that our drinking age is 21 is actually, I guess, helping to prevent kids from drinking. Availability and access to alcohol, an urban setting, poverty, and community school and violence. So co-occurring disorders. So studies show that 61 to 88% of adolescents who use alcohol also have a concurrent mental disorder, which is a huge amount. And a lot of these are undiagnosed. So some children are even self-medicating, children who are depressed, children who have attention deficit hyperactivity disorder who aren't well medicated, kids who have bipolar or anxiety, post-traumatic stress disorder, or schizophrenics. And these all will also, a huge percentage will go into drinking. Why drink, and why is it so exciting? So the adolescent brain is still developing and maturing. So what happens is, because your brain is still developing and maturing, once you're exposed to alcohol, the brain in an adolescent gives you that positive reinforcement. It makes you feel good. It makes you feel happy. In adults, there is something that also causes you to feel sleepy or tired under your drink, that you've had too much drink, you need to stop. In adolescence, because the brain is still developing, we don't have that just yet, and so you keep going because you feel fine, you don't feel sleepy, you don't feel tired, you don't feel drunk, you keep drinking, and then that can lead to more drinking, heavier drinking, and because you're enjoying it, more likely to do it again. So, like I said, the adolescents are less sensitive to the sedative effects, and so, and you're also, that's a huge reason, is because that's what studies are showing. Again, no one knows for sure, but that's the hypothesis. Is there a hereditary component? A lot of people are thinking yes. So adoption, twin, and extended family studies have shown a genetic or heritable component of predisposition to alcohol use disorder. So if you have a parent or a sibling or someone who was an alcoholic or used drugs or alcohol heavily, there is a predisposition. Children of alcoholic or several alcoholic family members places a person at greater risk. They're 4 to 10 times more likely to begin drinking and to do so at an earlier age. So consequences, obviously, alcohol contributes to accidents, deaths, increase in sexual behavior, both consensual and non-consensual. And that's an important point. You know, a lot of people, they're drinking, they're having fun, they're at a party, and it'll lead to, you know, whether it's date rape or it's, you know, a regret the next day, or even actual you know, rape or other non-consensual activities are definitely increased by alcohol. So it's, you know, always be careful. I always tell my patients, go with a buddy if you're going to a party. Make sure you go with that buddy, you leave with that buddy. If you notice that someone's had too much to drink, take them home, stop them. You guys need to watch out for each other. And the younger you start, the more likely you're to engage in other risky behavior, like other drug use, poor grades in school, risky sexual behavior. Also, the younger the start age, a lot of, especially in younger girls, if they start drinking younger, will end up dating or, you know, associating with older boys, and that'll also lead to more of this risky behavior. Long-term effects. So alcohol can cause functional and structural changes in the hippocampus that persist to adulthood. So what you do now will affect your later in life. Memory function, coordination. Some will even have seizures later in life, and they traced it back to early heavy uses of alcohol. Reduced white matter in the prefrontal cortex. That's a lot of the memory, and that will, you know, worsen working memory, which are, you know, things when you're studying for SATs, you're doing math, you know, as you get older in the grades. And it increases your vulnerability to alcohol use disorder, to developing an actual alcohol or drug problem later in life. You can get some degree of liver damage as well. And they say that the lasting effects are more pronounced in males. So for all you guys out there, careful. So what can we do? Obviously, things like this that you're doing today, you educate on the lasting effects and negative effects of alcohol. Encourage involvement in clubs, sports, interests, hobbies. I find when you're busy doing something you love or that makes you feel good, such as you're on a sports team, you're in the drama club, you're playing an instrument, you're working on the school paper, less likely to get bored and look for, you know, other things to do. A stable home environment is always key. Accurately diagnose mental illness. You know, make sure that if someone is depressed or down, or, you know, there's something else going on, that we find that and we help them the appropriate methods so that they don't turn to drugs and alcohol. A no tolerance policy, you know, which is the laws that are no tolerance now if they find it underage drinking, and the age limit on alcohol all helps. Fetal alcohol spectrum disorder encompasses physical, mental, behavioral, and cognitive effects that occur in individuals. Alcohol is a teratogen with irreversible central nervous system effects. And there are strong environmental and genetic risk factors for the development of substance abuse disorders. And the effects of alcohol can be especially detrimental to adolescents because it's a period marked with rapid and extreme neurobiological change. Your brain is still developing at this point right now, so it's even more dangerous to drink at this age. Early initiation of alcohol use is one of the most powerful predictors of later alcohol use. So the earlier you start, the more likely there'll be a problem later on when you're older. And then alcohol exposure during adolescence causes the functional and structural changes in the brain that can persist into adulthood, and it leads to other risky behaviors that we talked about. And there's still a lot of the effects of alcohol in the developing adolescent brain that we don't know about. There are a lot of studies going on, but there's a lot we don't know. So there's still a lot that we have to find out. Any questions? Yeah?
It has like damage to you. Does that depend on how much you drink, obviously?
So it actually, they're showing it does not necessarily depend how much you drink. Even if you're just having like 1 or 2 drinks, it can alter the chemistry in your brain. And what happens with that is then the chemistry that gets altered in your brain, you end up liking it because it has a positive effect, and so you're more likely to drink more, and so that leads to a negative pattern. If you've had a sip of champagne at a wedding, obviously it's not going to affect. But if it's a habit, you go every weekend, you're at a party, you have 1 or 2 beers or 1 or 2, yes. So the question was that we said with fetal alcohol syndrome that it can affect mathematics and, you know, learning later in life, right? That was the question. So the way, because with when the fetus is exposed to alcohol, and it all depends also on when in pregnancy is exposed. The earlier, the worse it is. But the brain is still developing, and so the children are born with actually smaller brains and smaller heads. And the part of the brain, the prefrontal cortex and the hippocampus, which are the parts involved in memory and spatial and numbers, and all, which are what you use for mathematics, is smaller in those children. And so that's why they have problems with that later on. If throughout their life they don't drink or do drugs, these kids who were born with fetal alcohol syndrome, will their development improve, right? Or their learning? Unfortunately not. That's why we really tell, mom or people who want to get pregnant, it's really important not to drink, because a lot of times people don't even know that they're pregnant until later on, and it can affect already. No, they're born with these deficits. They're born with their smaller brain. They're born with these problems. Again, if they don't drink or do drugs later in life, and they're plugged in, they have right away, they get the services, they get speech therapy and physical therapy and all this. They can do really well. Don't get me wrong. It's not like they're doomed, but these deficits that they're born with, they will have, and they'll just have to kind of, rise above them. I honestly don't. I think, and you're right to say that, some kids are, oh, sorry, the question was, should the legal drinking age be higher than 21, like older? Because some studies have shown that kids are still developing and going through puberty even in their early 20s. I don't. I think that most, again, by age 21, I do think most of the brain has, fully developed. And, I think also, realistically, it's going to be too impossible to do. I mean, kids are already drinking at a younger age. I do think the fact that it's 21 instead of 18 is a positive, because now they've done a lot of studies that compare 18-year-olds to 21, in Europe. And there have been more associated deaths, substance abuse, and things like that in the younger kids. Originally, it was thought that, it's not as exciting, because if you can drink since you're 18, by the time you're 21, it's not a novelty anymore, so people aren't going to be involved in those risky behaviors. But it's not the case. I think 21 is probably a good age for it. Okay. No, I'm not. Your team over here who led the symposium, they picked this topic.
Oh.
Yeah.
Well, I don't know how to say this in the right way. Like, so wait, so you just know about everything, right? Not like that, like.
Yes. The comment was that I just know about everything. I'm going to go with yes on that. I do not know about everything by any means. I see children from when they're newborns. Usually in my office, we see them till about 25 even, so through college for sure. So I do see kids of all ages. So I do know a lot about, the different illnesses and effects of, and like what's going on kind of in your lives. But if there's anything I don't know a lot about, I'll do some research and, read up on it.
What made you want to get into that?
Pediatrics?
Yeah.
Since I was sorry, we're a little off topic. It's funny, since I was little, I just really liked helping people. My mom will tell a story. When I was 3, our neighbor fell and cut their leg, and I ran over and I, cleaned it with a tissue, and my mom had a Band-Aid. I put a Band-Aid on. I was very into helping people and caring for people, and I've always loved children, even since, I was your age. I always loved, so I thought it would be very interesting and rewarding job, and I love it. So, yeah. Other questions? Yeah. Did everyone hear that question?
Yeah, for the sake of
for the camera. You're recording. Okay. So it was, at what age about does the brain finish developing and growing, and especially what is going on in the brain around this age group, like 15 to 18, 20? Yeah. So there's a difference between females and males, believe it or not. So people say, boys are very immature in a way. Yes. So females tend to mature a little earlier than males, and that includes the development of the brain. So what they still don't know 100% exactly what's developing. Parts of the brain that are the neurotransmitters, some of that cause enjoyment, things that are still developing, and some of the connections in the hippocampus, which is part of, that does like the pleasure center is there, along with the prefrontal cortex, the front of the brain, which is cognition and memory and things like that. Those are the two that they have studied both in MRI studies of actual people, and then like they've done a lot of like rat studies of adolescent mice and how different changes affect. And so usually those are what's still developing. And so and there's also at that age there's still that like risk-taking behavior, and that's also part of the brain because your synapses are still want you to experiment and like adventure and things like that. And that as you become an adult, usually they think till about like 22, some even till 25, and it depends. Some develop earlier, some later, so there's like a broad range of it. But I think until that age, all of that is still kind of developing. And so the neurotransmitters that cause pleasure and pain, and the working and spatial memory, that's still developing. And so that's the main part that's still going on at that age. As far as they know, they're still figuring it out, believe it or not. Yeah. So the question was, does less sleep affect the brain as well when you're an adolescent? And it's a great question, and the answer is yes. Believe it or not, you do need to get about at least 8 hours. I know that seems like a huge amount of sleep. I'll tell you 7 and I'll be okay with it. Because yes, your brain needs to rest in order for it to absorb everything you've learned during the day and that you've done, and to be well rested enough to be able to learn and function the next day. They also find that if you haven't had enough sleep, people can lose weight, are more stressed, are more anxious, and all that, especially in an developing adolescent brain. And in my office, we always joke that it makes no sense that in high school you start earlier than you do in preschool, because my kids, I could tell you're up at like 6 in the morning and can go all day, and you like give all these homework and sports and after school activities, you could use a later start to the day, or even nap time in the middle of the day. I know it's unrealistic, but that yes, you need it the most, actually. Yeah, so the question was if I've personally ever had patients with like fetal alcohol syndrome or et cetera. Yes, I trained, I went to medical school in Brooklyn, and I trained in the Bronx at Jacobi. So and part of the training, you work in the NICU, the neonatal ICU, and we had I had many patients with fetal alcohol syndrome that we worked with. The good thing is if you can catch it early, before they even leave the hospital as a newborn, they get plugged into services where people are helping them with speech and movement and feeding. We get support for the parents, and so if you catch it early, they can do really well. But I'm not gonna lie, I've seen one or two that, I mean, they were born and they're going to have lifelong struggles right off the bat, no matter how much they get help with. The question was, do I think that in school districts, do we talk to, like as a practice or a pediatrician, do we talk to the districts if children are having learning issues or other behavioral issues, whether they should be looked into, whether fetal alcohol syndrome could be a cause. I'll be honest, it's interesting where here in Westchester, you see it a little bit less than when like in the Bronx or in Brooklyn. There, yes, the teachers, they all knew, the schools were attuned to it, and the doctors. And I could tell you, if any child is having, if we see their, for example, their growth curves, they're falling off their growth curves, or they have a small head, we will, when a parent comes in, and we ask them, any parent that comes in right away, you get questions like, how much alcohol did you have during your pregnancy? Does anyone drink at home? Anyone use drugs at home? For two reasons. One, to get an idea also for the child, but also to get an idea of what environment the mother is in, to make sure that, the mom is in a safe and like nurturing environment as well to care for the baby. But we do, we have like checkpoints when you come for your checkups every time. Are you meeting your growth requirements? Are you doing well in school? We have depression questionnaires. We have development questionnaires at the 18-month visit, at the 2-year visit, which are when you can catch a lot of these things. We haven't really spoken to the districts, so it's something we can look into. But I know as a practice, we always, and if anything seems off, or a parent brings up, they're really fighting a lot or tantruming a lot, or they were doing really well in school up until 2nd grade, and now when reading has become more intense, they're having a lot of issues, and then we'll work up and see what we can find.
Muchísimas gracias, doctora.
De nada,
Gracias,
thank
gracias,
you
gracias.
guys.
Quiero agradecerles a todos ustedes. I want to thank you all here, students participating in the audience. I want to thank Ms. Livingston and your class. I want to thank Ms. Mastro-Mijales and her class, Ms. Restrepo and her class. Quiero agradecer la clase de la señora Livingston, la señora Mastro-Mijales, ahí está, mejor, ¿no? Y la señora Restrepo. Gracias por venir aquí todos ustedes hoy. Quiero agradecer también igual el señor Shepard. Thank you, señor Shepard, for always being here and keeping our video library. And gracias al grupo Alexander 2018. Can you guys stand up, please? ¿Se pueden parar, por favor? For producing this academic symposium. Gracias. And not least, la doctora Alexander otra vez, por favor. Gracias a la doctora Alexander. Thank you, Dr. Alexander. I hope all of you enjoyed the academic symposium in 2 parts. I wish you all a great, great day. Gracias.